Welcome to Module 3 of the Vaccine Education Outreach Program. This is part of the U.S. Department of Health and Human Services Centers for Disease Control and Prevention's Immunization and Vaccines for Children grant project. The project aims to provide support for improving vaccination rates in the city of San Antonio and Bexar County. The San Antonio Metropolitan Health District, or Metro Health, on behalf of the city of San Antonio, has partnered with ADMT Solutions Home Health to assist with the vaccine education outreach. When it comes to our mission and value proposition, ADMT Solutions delivers compassionate, caring services to help our clients and patients improve their quality of life. Our service delivery will demonstrate that we are the team always doing more than to meet each client's needs. Be sure to complete the pre-test before viewing this session. The name of this module is How to Debunk Misinformation and Bolster Vaccine Confidence. The objectives: at the end of this presentation, you'll be able to explain the history of vaccine opposition, discuss factors that influence vaccine confidence, review what research says works to bolster vaccine confidence, debunk misinformation, spot tactics used to spread information, and promote vaccines within your community. I know that we're hearing a lot about misinformation right now, but misinformation about vaccines is actually not a new phenomenon. It's been around as long as vaccines have. If you remember from Module 1, the first vaccine was made using a virus that causes cowpox, a virus that was similar to smallpox. Because the viruses were so similar, by getting cowpox and recovering from it, people were better protected against smallpox. It was revolutionary. But a lot of people were terrified of the idea of purposely infecting themselves with a disease that affects animals. Misinformation started spreading around that time, suggesting that because it was made using cowpox virus, it would turn people into cows or cause cows to start sprouting all over their bodies. This, of course, wasn't true, but it was a myth that spread at that time. As we started developing more vaccines and new vaccine technologies, concerns and misinformation about vaccines has shifted, almost like a game of whack-a-mole. We'll cover some of the most common misconceptions and misinformation circulated about vaccines today, but we'll also talk about the toolbox we can use to address this misinformation, as well as where you can go to verify claims that might crop up in the future, so that when new myths circulate, you'll know how to address them. Unfortunately, there's a whole community of anti-vaccine activists that spread misinformation about vaccines, jarring, scare people away from vaccinating themselves or their families. They use a wide variety of techniques to spread misinformation. The Center for Countering Digital Hate has a great report called The Anti-Vax Playbook that outlines many of the tactics used to spread mis and disinformation. This report will be available in your handouts or links after the presentation if you're interested. But here are the screens. You can see just how some of the ways anti-vaccination activists spread this misinformation. For example, they use jarring and vivid imagery like the doll photo here. That imagery is purposely designed to spark strong emotions like anger and fear, which can cloud our judgment and make us act impulsively, like sharing an image without really verifying it's true. Another tactic used by anti-vaccine activists is to target vulnerable and mistreated populations with misinformation to gain more followers. Some groups that are often targeted by anti-vaccine activists include families who have recently lost a child. They'll sometimes bombard these families with messages encouraging them to blame vaccines for their child's death, even if there's no medical reason to believe the vaccine was behind it. Losing a child is devastating, and when these stories are shared and tied to vaccines, it can invoke strong emotional response that, again, can make people act without thinking critically about what they're seeing. Another tactic that has been gaining steam is purposefully targeting and mistreated populations, especially African Americans and Black people in the U.S. With this misinformation designed to prey on their trauma and misleadingly tie vaccines to the horrors of racism. These groups have often experienced racism in healthcare settings or as part of research, and anti-vaccine activists try to connect these injustices and atrocities with modern-day vaccines and vaccination policies. Unfortunately, by doing this, anti-vaccine activists are actually further hurting these communities by leaving them vulnerable to vaccine-preventable diseases. So I mentioned that misinformation isn't new, but social media has made combating it more challenging. Many of the social media platforms use algorithms to determine what you see in your news feeds and what order. And they do this by taking into account that what or who you've interacted with most in the past. The more you engage with sources of misinformation, the more likely you are to see their stuff, and it can cause a feedback loop. As I mentioned, some social media platforms have tried to take steps to limit the spread of impact of misinformation by using warning labels on the content that might be false and allowing you to report things you think that are misleading or inaccurate. But activists are very good at gaming these algorithms and mitigating strategies and hitting just the right nerves to help misinformation spread far and fast, as we see in the previous slide. So question, true or false? We should just ignore misinformation when we see it online. The answer, false. While it's true that we should limit how much we engage with misinformation on social media, we shouldn't ignore it. Instead, we should take concrete steps to combat it. As community health workers and concerned family, we have a responsibility to be on the lookout for false and misleading information about vaccines and report it. The approaches of community health workers and concerned family and friends can use to respond to misinformation will vary based on the context and their comfort level. For example, you might do something differently if you have only a minute or two to respond than you would if you had more free time. The important thing to remember, though, is that you are doing something. The more misinformation goes unchallenged, the more likely it will be seen, spread, and potentially believed, which can result in dangerous consequences. Debunking misinformation. This formula is from the Debunking Handbook and UNICEF's Vaccine Misinformation Management Field Guide. This formula leverages research and psychology and communication to craft debunking messages that could help change people's minds about misinformation. First, we start with the fact, and this fact should be just as eye-catching or sticky as misinformation usually is. You want to get people's attention so they read on, and you want to put it at the top so that if they read is the first part before scrolling past. You sow that seed of doubt that the misinformation might not be true. Then once you kick it off with a sticky fact, let people know about the misinformation that you're debunking. Then explain why some people believe the false claim and how we know it's not true. And then you want to end strong with the fact that you want them to remember. Then of course, rinse and repeat. Don't be afraid to debunk often. Misinformation is hard to dislodge. Someone might need to see misinformation be debunked multiple times in multiple ways before they change their beliefs. And even then, it may take longer yet to convince them to change their behaviors, even after they stop believing the misinformation. These are some resources that community health workers and family and instructors can use to learn more about how to address and respond to misinformation online. You'll be able to see these on the ADMT Solutions Home Health vaccine education page as well. So question, true or false? When someone you're talking to one-on-one repeats a piece of misinformation, you should ask questions before debunking it or telling them why it's not true. The answer is true. When you're talking with someone one-on-one, jumping straight to why they're wrong can backfire and cause them to go into defense. Explain that talking to people one-on-one about vaccines often requires different approach than debunking misinformation on social media. Vaccine confidence isn't a light switch, something you have or you don't. It's a spectrum, a gradient, and one that can change over time and from one day to the next. A lot of things can influence how we feel about vaccines and whether we decide to get vaccinated. Empathy and trust are critical to building vaccine confidence. We all have reasons to believe what we believe. As community health workers and concerned, we need to use our powers of empathy to see where people are coming from so we can help reassure them and help them find accurate information that they need to take to make best decisions for themselves and their families. That's how we increase vaccine confidence, through relationships in our community, one conversation at a time. When talking about vaccines, there are some general tips that can be helpful. First of all, listen with empathy. Then ask open-ended questions such as, what are your concerns? Or how important do you think it is to protect yourself from COVID? Motivational interviewing is a great complementary skill that might be helpful for discussions. Encourage community health workers and family to look into motivational interviewing courses in your area that they are interested in learning more about. Also, ask permission before you share information as a show of respect for them and their autonomy, and to signal to them that they're an equal partner in this conversation. Help them find their reason for getting vaccinated. One way you can do this is by sharing your own. Help navigate them to vaccine services. There are many reasons someone might not be vaccinated that have more to do with access issues than misinformation. So question, true or false? When a conversation gets heated, you should try to talk as much as possible. The answer is false. This is a common conversation pitfall. If things get heated, one way to diffuse the tension is to ask questions and listen more than you speak to allow things to cool down. Here are some resources that are available for community health workers and families. If you'd like to learn more about how to combat vaccine misinformation or talk about vaccines one-on-one. And once again, this information will be available on ADMT Solutions Vaccine Education page. So that is the end of Module 3. Please take time to fill out the post-test for this session so that you can get credit. Thank you for listening.